Founded in 1993, Lee Medical's ongoing goal is to provide quality, cost-effective vascular access by offering clinical expertise, superior service, and products at capped cost to healthcare customers.
Lee Medical is an outsourced vascular access provider. We provide services 24 hours a day, 7 days a week. We have evidence-based practice times 15 years that have produced the outcomes that we're able to produce, and so our name is synonymous with quality. I'm often asked why a hospital should use our outsourced services rather than creating an in-house team. We're able to improve patient satisfaction, we're able to reduce cost, and we're able to improve quality.
Lee Medical's employees receive a level of training and experience in vascular access that is unattainable in a traditional healthcare setting.
They're very high quality. They've got the skills that's required, and we have had no patient complaints ever on them. They've been here over 10 years.
Many of our patients are heavy. They weigh anywhere from 300 to 500 pounds. They're very difficult people to get any type of line into. The quality and the results we've had with Lee Medical have just been outstanding.
Expertise in vascular access means fewer healthcare-acquired infections.
They do a good job initially. They also follow the line as long as the patient has the line in place. Our central line infection rate has plummeted nearly to zero since we started using Lee Medical.
We've seen minimal infectious complications from peripherally inserted lines since Lee Medical has been utilized here.
Fewer infections mean cost savings for the facility. In one study, the average cost associated with a catheter-related bloodstream infection was over $91,000, but reimbursement only averages $64,000, leaving a $26,000 loss for the provider. Soon, reimbursements from CMS for healthcare-acquired infections will be eliminated, further eroding the provider's bottom line.
Lee Medical's business model is innovative in that it is a breakthrough value proposition for healthcare. We offer a capped cost service, a fee for service, if you will, that flexes with the volume of the hospital.
She bundles the cost of the catheters and equipment, the insertion of the catheters and the follow-up of the catheters as a one-price procedure, and it's extremely cost-effective.
Lee Medical also gives providers an alternative to the constant training cost caused by employee turnover.
It's hard to maintain a pool of people who can maintain their skill level. You just don't get the repetitions that you need to maintain your clinical competence.
Anyone in the healthcare business knows that any procedure that you're doing, if that's the main procedure you do, you become much more adept at it.
Well, Lee Medical is specialized in that service, so their staff gets the number of repetitions that they need to maintain their clinical skills at a high level.
Michelle is a AAA personality, hardworking, and wants the best for the patients. And I think she has driven her staff to do the best.
Michelle met us in the emergency room at about 11:30, 11:45 on a Friday night. It was cold, December, and she came in and talked to my daughter and calmed her down, and within about 5 minutes she started an IV. If you had been there for the previous hour of the unsuccessful attempts, I'm lucky because Lee Medical was out there.
Lee Medical's innovative business plan successfully addresses three powerful challenges facing healthcare providers.
This is a very complex business that we're in, and it's helpful and reassuring to have an aspect of it get managed in a high quality way.
It is better quality for the patient, and it's considerably cheaper for the patient when Lee Medical does PICC line insertions.
Our infection rate is less than the national average. Our DVT rate is less than the national average, and our dwell times of our line are greater than the national average.
Lee Medical constantly strives to serve the patients, the nurses, the facilities, and everyone across the entire community of healthcare providers.
Facilities that are interested in patient safety, in quality outcomes that are documentable data, Facilities that are innovative, CEOs that are visionary, they see the impending nursing shortage and they want to make sure that their hospital has the very best in the highest skill level in vascular access.
So we've got timely service, absolute quality, the highest quality that I've seen in any of my experience at any of the hospitals I practice at, and then at a cost that's below what we have always paid in the past. It's hard to find a better combination than that.
I would recommend Lee
Yes,
Medical.
I would recommend Lee Medical.
Yes, I can recommend Lee Medical to other hospitals.